Welcome to the COVID Assessment Centre here at King's Cross Hospital. This is a short video to familiarise yourself with how the Assessment Centre is currently running.
Patients are currently triaged into coloured streams and then assessed within separate clinical areas.
We are currently running 3 pathways: yellow, green and blue. Patients are greeted by a marshal at the entrance to King's Cross, where they are checked in and guided to the appropriate waiting area. Each pathway has its own pharmacy, changing facilities and staff room. Please familiarise yourself with these when you arrive for your shift. Scrubs are available to wear in each area.
The yellow pathway is for patients with non-COVID related illness. This is largely used out of hours, although we have the capacity to use this in hours if required. This is also where the Tayside triage service is currently based. Patients in the yellow pathway are phoned by the clinician who asks them to make their way from the yellow parking spaces to the main entrance. The doctor meets them at the front door, walks them to one of the yellow consulting rooms and undertakes the consultation.
The green pathway is for patients with possible COVID-related symptoms. These patients are seen outside in our assessment units. Patients in this pathway are asked to wait in the green car park area and to remain in their car. The clinician calls the patient and takes a thorough history in order to limit face-to-face consulting time. When the clinician is ready, the patient drives round to one of the numbered outdoor assessment units. The clinician dons full PPE and assesses the patient, who remains within their vehicle. They are assisted by a healthcare assistant throughout. If medication is required, this can be obtained from the dedicated green pathway pharmacy. Sometimes this can be preempted based on the initial history and taken out on the assessment trolley. If admission to hospital is required, the patient is given a mask and a patient information leaflet with directions and the contact number for the East Block COVID Assessment Unit. Once the assessment is complete, the clinician removes their PPE outside. The Adastra consultation can be completed in the green clinician area and a referral made to the East Block COVID Assessment Unit if required. The completed call sheet will be available on Clinical Portal for the secondary care team.
The blue pathway is predominantly for children under the age of 14 with possible COVID-related symptoms. It can also be used for adults who are unable to be seen within the green pathway. Patients who are unable to attend the outdoor assessment units include parents who have symptoms and require assessment at the same time as their child, and adults with COVID-related symptoms who attend on foot. Patients attending in the blue pathway should wait in the blue car holding area. The clinician calls the patient and takes a thorough history in order to limit the face-to-face consulting time. When the clinician is ready, they ask the patient to drive to the blue pathway entrance. The clinician meets the patient in full PPE and gives them a mask to wear. They are guided to the consulting room for clinical assessment. A healthcare assistant is available for support throughout. Once again, there is medication available, and if admission to hospital is required, a similar process can be followed as for those in the green pathway. When the consultation is complete, the patient is directed by the healthcare assistant towards the exit. They are advised to take off their masks and to wash their hands with alcohol hand gel prior to leaving.